Did you know that every 40 seconds someone in the United States has a stroke? But here's what might save your life or the life of someone you love. Your body doesn't just suddenly have a stroke out of nowhere. It sends you warning signals, sometimes weeks or even months before it happens. And today, I'm going to share with you the 10 critical warning signs that could mean the difference between life and death. I'm going to be completely honest with you. When I started researching this topic, I was shocked to discover how many people miss these early warning signs. The American Heart Association tells us that recognizing these symptoms early and acting fast can prevent up to 80% of strokes. That's not just a statistic, that's potentially millions of lives that could be saved simply by knowing what to look for. Before we dive into these warning signs, let me explain something important about how strokes actually happen. A stroke occurs when blood flow to part of your brain is interrupted or reduced, preventing brain tissue from getting the oxygen and nutrients it needs. The World Health Organization defines stroke as rapidly developing clinical signs of focal or global disturbance of cerebral function, lasting more than 24 hours or leading to death, with no apparent cause other than vascular origin. There are two main types of strokes. Ischemic strokes account for about 87% of all strokes, according to the Centers for Disease Control and Prevention. These happen when a blood clot blocks or narrows an artery leading to the brain. Hemorrhagic strokes, making up the remaining 13%, occur when a blood vessel in the brain leaks or ruptures. Both types can send warning signals before they strike. And that's exactly what we're going to talk about today. The first warning sign you need to know about is transient ischemic attacks, commonly called TIAs or mini-strokes. Research published in the New England Journal of Medicine shows that about 1/3 of people who experience a TIA will have a major stroke within a year if left untreated. A TIA produces the same symptoms as a stroke, but they're temporary, usually lasting only a few minutes to a few hours, and then completely resolve. Here's what makes TIAs so dangerous. Because the symptoms go away, many people ignore them. They think, "Oh, I'm feeling better now, so it must not have been serious." But according to the National Institute of Neurological Disorders and Stroke, a TIA is like a fire alarm for your brain. It's warning you that something is seriously wrong with your blood flow, and you need to take action immediately. The symptoms of a TIA are identical to stroke symptoms: sudden weakness or numbness on one side of your body, sudden confusion or trouble speaking, sudden vision problems, sudden severe headache, or sudden trouble walking. The key difference is that with a TIA, these symptoms resolve completely within 24 hours, usually much sooner. The second warning sign is sudden severe headaches that are different from your normal headaches. Now, we all get headaches from time to time, but I'm talking about something very specific here. The American Stroke Association describes these as thunderclap headaches, headaches that reach maximum intensity within seconds to minutes and are often described as the worst headache of your life. A study published in the journal Stroke found that about 7% of people who later had a stroke experienced these severe headaches in the weeks leading up to their stroke. These headaches are often accompanied by neck stiffness, nausea, vomiting, or sensitivity to light. What makes these headaches particularly concerning is their sudden onset and severity. If you've never experienced anything like it before, or if it's dramatically different from your usual headache pattern, this could be your brain telling you that something is wrong with your blood vessels. The third warning sign involves sudden changes in your vision. The National Eye Institute reports that vision problems can be one of the earliest signs of an impending stroke. This isn't just about needing new glasses or having tired eyes after a long day at the computer. I'm talking about sudden visual disturbances that come out of nowhere. These vision changes can include sudden loss of vision in one or both eyes, double vision, or visual field cuts, where you lose vision in specific areas of your visual field. Some people describe it as having a curtain drawn across part of their vision. Research from Harvard Medical School shows that these visual symptoms occur because the areas of the brain responsible for processing vision are being affected by reduced blood flow. What's particularly important to understand is that these vision changes often occur without any pain. You might suddenly realize you can't see properly, but there's no discomfort, which can make people more likely to dismiss the symptom. Don't make this mistake. Sudden, painless vision loss or changes should always be treated as a medical emergency. The fourth warning sign is sudden weakness or numbness, particularly on one side of your body. The Mayo Clinic describes this as one of the most common early warning signs of stroke. This weakness or numbness typically affects your face, arm, or leg, and it's usually more pronounced on one side of your body than the other. Here's a simple test that emergency medical professionals use, and you can use it too. It's called the Cincinnati Pre-Hospital Stroke Scale. For facial weakness, ask the person to smile. If one side of the face droops or the smile is uneven, that's a warning sign. For arm weakness, ask the person to raise both arms and hold them up for 10 seconds. If one arm drifts downward, that's concerning. These tests, validated by research published in academic emergency medicine, can help identify stroke symptoms with remarkable accuracy. The numbness or weakness might start subtly. You might notice that your grip strength seems weaker on one side, or that you're having trouble with fine motor tasks like buttoning your shirt or writing. Some people describe it as feeling like their arm or leg has fallen asleep. But unlike normal numbness that comes from sitting in one position too long, this numbness doesn't go away when you move around. The fifth warning sign involves sudden confusion or trouble speaking and understanding speech. The American Speech Language Hearing Association explains that communication problems are among the most frightening and noticeable symptoms of stroke-related brain changes. This isn't about occasionally forgetting a word or having a tip-of-the-tongue moment that we all experience. This is sudden, significant difficulty with language that comes on without warning. You might suddenly find yourself unable to find the right words to express simple thoughts, or you might speak, but the words come out jumbled or don't make sense. Some people experience what's called receptive aphasia, where they can speak normally, but can't understand what others are saying to them. Research published in the Journal of Stroke and Cerebrovascular Diseases shows that these language problems occur because stroke affects the areas of the brain responsible for language processing, typically in the left hemisphere. Family members often notice these communication changes before the person experiencing them does. If someone close to you suddenly seems confused, can't follow simple instructions, or is speaking in a way that doesn't make sense, don't assume they're just tired or stressed. These could be critical warning signs that require immediate medical attention. The sixth warning sign is sudden trouble walking, dizziness, or loss of balance and coordination. The National Institute on Aging emphasizes that balance and coordination problems can be early indicators of stroke, particularly strokes affecting the cerebellum or brainstem areas of the brain. This isn't about feeling a little unsteady after standing up quickly or being dizzy because you haven't eaten in a while. I'm talking about sudden, unexplained loss of coordination that makes it difficult to walk normally or maintain your balance. Some people describe feeling like they're drunk, even though they haven't consumed any alcohol. Research from the International Journal of Stroke shows that these balance and coordination problems occur because stroke affects the areas of the brain that control movement and spatial awareness. You might suddenly find yourself veering to one side when you try to walk straight, or you might have difficulty with tasks that require coordination, like reaching for objects or walking upstairs. The seventh warning sign involves sudden, severe dizziness that's different from anything you've experienced before. While dizziness can have many causes, the type associated with stroke warning signs has specific characteristics that set it apart from more common causes of dizziness. The American Heart Association describes stroke-related dizziness as often being accompanied by other neurological symptoms. It's not just feeling lightheaded when you stand up too quickly or the spinning sensation you might get from an inner ear problem. This is a profound sense of disorientation that might make you feel like the room is spinning violently or like you're going to fall over, even when you're sitting down. A study published in the journal Neurology found that dizziness, when combined with other stroke symptoms, significantly increases the likelihood that someone is having a stroke or TIA. The key is to pay attention to the context. If you suddenly feel severely dizzy and you also have any of the other warning signs I've mentioned, this could be your brain telling you that it's not getting enough blood flow. The eighth warning sign is sudden difficulty swallowing, medically known as dysphagia. The National Foundation of Swallowing Disorders reports that swallowing problems can be an early sign of stroke because the brain areas that control swallowing are affected by changes in blood flow. This isn't about occasionally having food go down the wrong way or having trouble swallowing large pills. Stroke-related swallowing difficulties come on suddenly and make it genuinely difficult to swallow normally. You might find yourself coughing or choking on liquids or foods that you normally consume without any problem. Some people describe feeling like food or liquid is sticking in their throat. Research published in the Journal of Stroke shows that dysphagia occurs in up to 65% of stroke patients, and it can appear as an early warning sign before a major stroke occurs. The swallowing process is incredibly complex, involving coordination between multiple brain areas, and when blood flow to these areas is compromised, swallowing becomes difficult or dangerous. The ninth warning sign involves sudden changes in your level of consciousness or alertness. The World Stroke Organization emphasizes that alterations in consciousness can be subtle but important early indicators of stroke. This doesn't necessarily mean passing out completely, although that can happen. More often, it's a gradual or sudden change in your mental state that others might notice before you do. You might find yourself feeling unusually confused or disoriented, having trouble staying awake during times when you're normally alert, or experiencing what some people describe as feeling foggy or not quite right. Family members might notice that you seem less responsive than usual, take longer to answer questions, or don't seem like yourself. Studies published in Stroke Research and Treatment show that these consciousness changes occur because stroke affects the areas of the brain responsible for maintaining alertness and awareness. The reticular activating system, which keeps us awake and alert, can be affected by changes in blood flow, leading to these subtle but important changes in consciousness. The 10th and final warning sign is sudden onset of nausea and vomiting, especially when accompanied by any of the other symptoms I've mentioned. While nausea and vomiting are common symptoms that can have many causes, the Cleveland Clinic notes that when they occur suddenly and in combination with neurological symptoms, they can be warning signs of stroke. This is particularly true for strokes affecting the cerebellum or brainstem, areas of the brain that help control nausea and vomiting reflexes. The nausea associated with stroke warning signs is often severe and comes on suddenly, without any obvious cause like food poisoning or a stomach bug. Research from the European Journal of Neurology shows that nausea and vomiting occur in about 20% of stroke patients, and when they appear as early warning signs, they're often accompanied by dizziness, headache, or balance problems. The key is to pay attention to the pattern and combination of symptoms. Now that we've covered all 10 warning signs, I want to talk about something critically important. What to do if you or someone you know experiences any of these symptoms. The acronym FAST, promoted by the American Stroke Association, can help you remember the key steps. F stands for face drooping, A for arm weakness, S for speech difficulty, and T for time to call emergency services. But I want to expand on this because time really is brain when it comes to stroke. Research published in The Lancet shows that for every minute that passes during a stroke, the average person loses 1.9 million neurons. That's why the medical community has adopted the phrase, time is brain. The sooner treatment begins, the better the chances of minimizing brain damage and preserving function. If you suspect someone is having a stroke or stroke warning signs, call emergency services immediately. Don't drive yourself or have someone drive you to the hospital. Emergency medical services can begin treatment on the way to the hospital and can alert the hospital to prepare for your arrival. Studies show that patients who arrive by ambulance receive treatment faster than those who arrive by car. While waiting for help to arrive, there are several things you should and shouldn't do. Do keep the person calm and comfortable. If they're conscious, help them lie down with their head slightly elevated. Don't give them anything to eat or drink, as stroke can affect the ability to swallow safely. Don't give them medication, including aspirin, unless specifically instructed by emergency medical personnel. I also want to address some important risk factors that increase your likelihood of experiencing these warning signs. The American Heart Association identifies several modifiable risk factors that you have control over. High blood pressure is the single most important risk factor for stroke. Research published in The Lancet shows that controlling blood pressure could prevent about half of all strokes. Smoking significantly increases stroke risk by damaging blood vessels and increasing the likelihood of blood clots. The good news is that according to the Centers for Disease Control and Prevention, stroke risk begins to decrease almost immediately after quitting smoking and returns to near normal levels within 5 years. Diabetes, high cholesterol, obesity, and physical inactivity all contribute to stroke risk. But here's the empowering part. All of these risk factors can be modified through lifestyle changes and, when necessary, medication. A study published in the New England Journal of Medicine showed that people who followed a healthy lifestyle had an 80% lower risk of stroke compared to those who didn't. Diet plays a crucial role in stroke prevention. The Mediterranean diet, rich in fruits, vegetables, whole grains, fish, and olive oil, has been shown in multiple studies to reduce stroke risk by up to 30%. The DASH diet, specifically designed to lower blood pressure, can reduce stroke risk by up to 29%, according to research published in Stroke magazine. Regular physical activity is incredibly protective against stroke. The World Health Organization recommends at least 150 minutes of moderate intensity aerobic activity per week. Research shows that people who are physically active have a 25% to 30% lower risk of stroke compared to inactive people. Let me also address something important about age and stroke risk. While it's true that stroke risk increases with age, and about 2/3 of strokes occur in people over 65, according to the National Institute on Aging, strokes can and do occur in younger people. In fact, stroke rates have been increasing in adults under 45 in recent years. This increase in younger stroke patients is partly attributed to rising rates of diabetes, obesity, and high blood pressure in younger populations. It's also related to increased substance use, particularly cocaine and methamphetamines, which can cause stroke even in young, otherwise healthy people. Women face some unique stroke risks that are important to understand. Pregnancy increases stroke risk due to changes in blood clotting and blood pressure. Birth control pills, especially when combined with smoking, can increase stroke risk. Hormone replacement therapy after menopause also carries some stroke risk, although the benefits often outweigh the risks for many women. The American Heart Association has developed specific stroke prevention guidelines for women, recognizing these unique risk factors. Women are encouraged to have their blood pressure checked before starting birth control pills and to discuss stroke risk factors with their healthcare providers when considering hormone replacement therapy. I want to spend some time talking about the recovery and prevention aspects as well, because understanding what happens after recognizing these warning signs can be incredibly motivating for taking action. Modern stroke treatment has revolutionized outcomes for stroke patients. Clot-busting drugs like tissue plasminogen activator, or TPA, can dramatically improve outcomes when given within the first few hours of stroke onset. Mechanical thrombectomy, a procedure where doctors physically remove blood clots from brain arteries, has extended the treatment window for certain types of strokes. Research published in the New England Journal of Medicine shows that these treatments can restore blood flow to the brain and significantly reduce disability. But here's what's really exciting. Comprehensive stroke centers now exist across the country, equipped with specialized teams and advanced technology to provide rapid, specialized stroke care. The Joint Commission certifies these centers based on their ability to provide evidence-based stroke care. And getting to one of these centers can make a dramatic difference in outcomes. Recovery from stroke has also been revolutionized by our understanding of neuroplasticity, the brain's ability to reorganize and form new neural connections. Physical therapy, occupational therapy, and speech therapy can help stroke survivors regain lost functions by teaching other parts of the brain to take over damaged areas. Research from the National Institute of Neurological Disorders and Stroke shows that the brain's ability to recover continues for months and even years after a stroke, which means that improvement is possible long after the initial injury. This understanding has led to more intensive and longer duration rehabilitation programs that achieve better outcomes. Prevention, however, remains our most powerful tool against stroke. Beyond the lifestyle factors I mentioned earlier, there are some specific preventive measures that can make a huge difference. Regular medical checkups are crucial for identifying and managing risk factors before they lead to problems. Blood pressure should be checked at least annually, and more frequently if it's elevated. The American College of Cardiology recommends a blood pressure target of less than 130/80 mmHg for most adults. Cholesterol should be checked every 4 to 6 years in healthy adults, and more frequently if elevated or if other risk factors are present. Diabetes screening is recommended starting at age 35 for most adults, or earlier if risk factors are present. Managing diabetes effectively can significantly reduce stroke risk. The American Diabetes Association recommends maintaining hemoglobin A1C levels below 7% for most adults with diabetes. Atrial fibrillation, an irregular heart rhythm that affects millions of Americans, significantly increases stroke risk. The American Heart Association estimates that atrial fibrillation increases stroke risk by 4 to 5 times. If you have atrial fibrillation, working with your doctor to manage it properly, often including blood-thinning medications, can dramatically reduce your stroke risk. Sleep apnea is another often overlooked risk factor for stroke. Research published in the American Journal of Respiratory and Critical Care Medicine shows that severe sleep apnea can double or triple stroke risk. If you snore loudly, have witnessed breathing interruptions during sleep, or wake up gasping or choking, talk to your doctor about sleep apnea evaluation. Stress management is also important for stroke prevention. Chronic stress can contribute to high blood pressure and other stroke risk factors. The American Psychological Association recommends regular stress reduction techniques like meditation, deep breathing, regular exercise, and maintaining social connections. Let me share something personal that really drives home the importance of recognizing these warning signs. Every stroke prevention success story starts with someone recognizing that something wasn't right and taking action. Whether it's a person who noticed their own speech becoming slurred, a family member who recognized facial drooping, or someone who took their sudden severe headache seriously enough to seek medical attention, these stories all have one thing in common. Someone recognized the warning signs and acted quickly. The science is clear, and the message is empowering. Strokes are largely preventable, and when they do occur, early recognition and treatment can make an enormous difference in outcomes. The 10 warning signs I've shared with you today aren't just medical facts. They're potentially life-saving information that could protect you and your loved ones. Your body is incredibly intelligent, and it will warn you when something serious is wrong. The key is learning to listen to these warnings and take them seriously. Don't dismiss sudden, unusual symptoms as just stress, fatigue, or aging. Trust your instincts, and when something doesn't feel right, especially when it involves the warning signs we've discussed, seek medical attention immediately. Remember, recognizing these warning signs isn't about becoming anxious or fearful about your health. It's about being empowered with knowledge that could save your life or the life of someone you care about. Share this information with your family and friends. Make sure they know these warning signs too. Because stroke can happen to anyone at any age. The most important message I want you to take away today is this: you have more control over your stroke risk than you might think. Through healthy lifestyle choices, managing risk factors, and knowing these warning signs, you can significantly reduce your risk of stroke and improve your chances of a good outcome if warning signs do appear. Take care of your health, pay attention to your body's signals, and remember that when it comes to stroke, time truly is brain. The few minutes you spend recognizing these warning signs and seeking help could mean the difference between a full recovery and permanent disability, or even the difference between life and death. Your health is worth that attention, and your life is worth that action.